When we're talking about marginalized populations and communities, we have to note that there was a recent report mid-January that indicated that, there was just 25 doses administered in low-income countries in Guinea, and that was just one country, whereas all the other wealthier countries, around 39 million doses were administered. So it's a striking difference.
This is the Public Health Insight Podcast.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
In the previous episode, we introduced viruses as infectious agents that need host cells of living organisms in order to replicate, while briefly introducing the concept of mutations in genetic codes. In this episode, Will, Gordon, LaShawn, and myself, Sully, transition the conversation to examine the broader implications for mutations in the SARS-CoV-2 virus and what that means going forward. This is where we left off.
This has been a very interesting discussion so far, and I wanted to go back to something you mentioned earlier of something you called SARS-CoV-2, and this relates back to one of our earlier episodes when we first introduced and talked about COVID-19. Tell us or remind us, what is SARS-CoV-2 and how is it different from COVID-19?
SARS-CoV-2 is the actual virus itself, whereas COVID-19 is the actual disease and its manifestation.
Okay. Having cleared that up, I'd like for our conversation to move towards, having talked about what is a mutation and a better understanding of it. How has the SARS-CoV-2 virus been affected by mutations, or has it since the last year, where it's been in the news and kind of creating all these changes in the world that we're seeing today?
So what we see out there as its predominant form is the variant called D614G, which is basically a fancy notation to say at a single point of the genomic sequence, there was a substitution from aspartate to glycine. And so we see that this emerged late January to early February in 2020, and it differed from the actual sample that was initially found in Wuhan, China. So there's been a lot of different research and studies that have gone into looking at this variant. And I was listening to a podcast where Dr. Ralph Barrick from the University of North Carolina was talking, and his group has done a lot of research on this new variant, whether it just be on models just looking at infectivity in cultures. And they compared this new variant to the original ancestor, and it found that this new variant was almost 10 times more infective or transmissible amongst the culture plates in vitro. So that led them to do further studies to show, how much different are these two viruses? Like, are there any differences in terms of severity, etc.? And so they also collaborated with individuals from Wisconsin, University of Wisconsin, and they basically used a hamster model. And they also showed in that hamster model that this newer variant, the D614G variant, was actually more transmissible than the ancestor, the original SARS-CoV-2. So, and we have to take this with a couple caveats, right? This is a hamster model. This is not indicative of how it's going to, work or function in a human model, for example. So what they essentially found that there was a higher viral load within these hamsters for the newer variant, but there wasn't too much of a difference. It was just kind of a modest increase in viral load, but it didn't really make too much of a difference in terms of overall severity of the disease. They did find that in this newer variant, there was a bit more weight loss, but it was just a modest weight loss that occurred. But interestingly, what they did find as well, though, is that they found on the surface of SARS-CoV-2 that this mutation actually allowed for a flap on the membrane of the protein, which is a spike protein used to penetrate and infect cells. They found that this mutation actually kind of opened up. And so this allowed for a couple things. It allowed for the virus to be able to better infect host cells, which what you may hear in the news saying, hey, this virus is found to be more transmissible. So that's one of the reasons, because the spike protein is more exposed, so it can allow for greater infection. And another point that Dr. Ralph Baric brought, which was really interesting, is that this new variant, although it is more transmissible, it also comes with kind of a trade-off, right? Right now, it's estimated around 5 to 10% of the population may be infected with COVID-19, right? So that leaves a huge proportion of the population, the global population, that's naive, meaning it hasn't been exposed to COVID-19. So right now, this mutation that allows for this flap that's more effective has a higher transmissibility. It allows currently the ability to infect more people. But as vaccines and there's a greater proportion of the population get immunity, there's going to be a pressure that's on this virus to adapt, because maybe it was actually found that this flap also has this downside to it where it allows the host's immune cells to actually neutralize it more readily and antibodies to more readily access this new variant. So it's actually more sensitive to those kind of counterattacks. So at that point, the virus has to also make changes, whether it's through mutations or other innovative strategies.
From what you said, then it's kind of almost a trade-off then, right?
Mm-hmm.
It becomes more infectious, but it also becomes more vulnerable and susceptible to the body's immune system.
Yeah.
So yeah, I just wanted to ask then, so going back to what you mentioned earlier about how they did initial studies in hamsters and in cell cultures, to have, I guess, to find the evidence that there was increased transmissibility. Is it ever going to be a possibility, or like for them to study what it's like in humans? Like let's say to see how transmissible it actually is between humans. I'm just curious because like I feel like in order to do that, there's definitely some ethical concerns with that. So I don't know. Yeah,
and Gordon will talk about this more, but you could see that's what's going on right now. The country-specific data that we're collecting, it's almost like a natural experiment. We're not intending for COVID-19 to spread everywhere, but based on collection and sampling, we're able to kind of trace these different variants of the virus.
And D614G, formerly, I guess it's still a variant, but formerly was like a novel variant. Now it's the predominant version of COVID-19 that circulates. So you can see, if you reflect a little bit on what we touched on in the beginning about the viruses that are more transmittable will tend to outcompete the maybe more deadly versions of the virus, because they're able to spread from person to person better. That's exactly what we're seeing with D614G, in that that's now the more dominant form of the virus that circulates, until there's another variant that comes along that even strikes a better balance with infectivity and like severity of disease, and that keeps happening. So we're already seeing it happening, and the way they kind of come to these conclusions is when they do sampling of people infected with COVID-19 and they sequence the DNA, they're able to have basically basic surveillance of the genotypes of the viruses that are circulating, and then they're able to see that D614G kind of started off in the minor percentages, and now it's when they do sequence, that's the most predominant one that they're finding. And then with the new variants that we'll be discussing, like the one South Africa variant and then the new UK variant, basic surveillance is telling them that the numbers of those infections are rising faster, and they're finding that the places in which they're picking up those in hotspots, there tends to be a more transmissibility of COVID-19 in those communities. And obviously you can test that through things like percent positivity when you do a COVID test, what percentage of people being tested for COVID come back positive. And that's usually a very good indicator of how bad the spread is in a certain area.
Yeah. And keep in mind that this data might not be perfect, given that there are a lot of gaps in certain surveillance systems, but scientists are doing their best to kind of get these estimations and do projections to give them a better idea of what they can expect.
Yeah, and not only that too, there's confounding, right? So in areas where there might be more severe spread, there might be more countermeasures like, lockdowns and stuff to prevent it. So we're not able to see, in, like you said, Will, we can't really do a control situation to find the exact answer. But it's these epi folks, the epidemiologists and all those scientists do a good job with their modeling to kind of tease out some of those things we can say, as best as we can in terms of some level of cause and effect.
Yeah. And I guess another thing to keep talking about surveillance a bit. In August to September 2020, a variant of the infection among farmed mink was identified in Denmark. And it was later transmitted to humans, and it was referred to as cluster 5. And there was initial fears about, what would be the result of this mutation in terms of the duration of the immune or the duration of kind of the infection or other traits in terms of severity. But as of December 31st, it was found that 13 identified cases had this variant and this mutation. So it's kind of an indication, at least to WHO, that humans have not appeared to kind of take up this virus, and it hasn't been spread too widely.
Yeah. But what's the broader lesson here, though?
The broader lesson is that mutations can be beneficial in the perspective of the virus, or sometimes they can actually diminish some of their infectivity.
The main reason they were focused on this example is because when we talk of zoonosis, so transmission of, pathogens from animals to humans or vice versa, our cells are different. So our cells are different from bats, our cells are different from our dogs, our cells are different from, other animals to varying degrees. So the virus, if it's the same virus related to, we talked about the ancestral strain like LaShawn talked about, in order to replicate in another host such as a dog or the mink, it has to mutate. So those exposures to animals being exposed to the SARS-CoV-2 is dangerous for us as humans in that it creates pressures for the virus to mutate further, infect the another host, another animal, pick up more mutations, and potentially jump back to us, being more deadly than it was the first time. So that's why this particular example is very important.
And I guess to add to that point, I think it's a very striking example for the need globally to consider the One Health model, where you're considering animals, humans, and the environment, because each of these components are very important in terms of managing the health of the environment, managing the health of animals, and managing the health of humans.
Yeah, this really comes back to one of PHI's earliest episodes on One Health, right? Where we talked about how if you think about mink, like an animal like the mink, it's supposed to be a wild animal. It's not like your domesticated cattle or sheep or things like that, in which over centuries or like millennia, they've kind of I think humans as well has become adapted to these animals. And so it really brings it back to the whole situation back in Wuhan with the at the market, where there's just all these wildlife kind of just there. I think this is a very similar situation, is it not, where you have farming facilities keeping these wildlife there for the purpose of human use or consumption, but I think that in itself poses more of a greater risk of transmission and of spread.
Absolutely. Like when there's nature is the way it is, and then human activity kind of creates a different environment where things that weren't previously interacting, whether it be animals or microorganisms that weren't in contact with each other before, are now having more opportunities to interact. There's a lot of things that can happen, such as a pandemic, and even go back to the story of Ebola. It's a pretty similar story with Ebola, how it happened, not necessarily a wet market, but there is whether selective pressures in terms of social unrest or what have you, that led people to being more exposed to various wild animals, and then those kind of introduced a new type of virus into the human population. And then when a virus is new to the population, there's no residual immunity, and then you get a lot of death. So that's unfortunately what happens.
Yeah. And so as we look and reflect on 2020, we have the first notable variant, which was discussed, the D614G variant. And then we had the next notable variant sometime in the late summer, which was the cluster 5 from Denmark. We move on to December 14th. And this was the date that the WHO announced that the UK officials reported a new variant known as VOC 2020-12-1, which I think stands for Variant of Concern, in the year 2020, in the month of December, and then it's the first variant. And this has since been commonly coined as the UK variant. And I think this is one of the ones that's, I would say, is of more of a concern right now. And I'm sure for our listeners at home, this is one of those variants that has been popping up across the news outlets, across the internet and things like that. So maybe let's talk about this and why it has become kind of dominating our regular just conversations.
Yeah, well, I mean, first of all, this is like some great naming choices right there. Gotta love that nomenclature. Secondly, I can talk about how people are talking about it, at least. There's a huge concern over like these kind of mutations and like how transmissible it is among the UK population, which, I mean, now it's spread to over 31 countries so far. So there's this general feeling that people are like, oh goddamn, we're gonna go through the same thing again, and which is very like tiring, and it becomes very straining on our populations, and like that would lead to less cooperative behavior with like scientific recommendations from, say, the government or from experts. So that's one area of concern.
Is this variant, VOC 2020-12-1, is it more severe than, let's say, the ancestral strain that was found in Wuhan, or even just the D614G variant?
Yeah, so right now the evidence suggests that the range of symptoms, I guess, and the severity of the symptoms, there's no significant difference compared to the ancestral strain or some of the other variants, as you would call it. But like, I think it starts off with, I mentioned before that most mutations are not a concern. So most mutations don't lead to a variant of concern. However, we're concerned when we notice in certain communities that the transmission rates are incredibly high, given that there's so many preventative or non-pharmaceutical interventions that are in place, such as lockdown, stay-at-home orders and stuff. So this gives research an inkling that there might be something deeper going on other than people just not following the rules. So a lot of these are discovered in those situations where there's an abnormally high transmission rate for COVID-19. And then when you sequence it, like you mentioned, you notice that, hey, this is actually a different variant of the one that we're used to. And then using techniques like LaShawn mentioned in the lab and stuff, you can actually test to see in vitro or even in animal models if the transmissibility rate is higher. From the human data that we have, like I mentioned, it does seem like there is no issues of concern in terms of severity of symptoms or negative outcomes such as the mortality rate, but they're reasonably certain that the transmission rate is indeed higher for this new variant.
Yeah. I guess just to bump back to that point you made about why do you think it's getting so much attention in the media, etc. I think there's a bunch of factors. The first one, I think, it has something to do with what Sully mentioned. That was the fact that people are getting, when these new variants pop up, it's very fatigue-inducing. Individuals are trying to, try their best to follow public health protocol, and then when they see that there's a new variant out there, it's like, oh, is there ever going to be an end to this? So I think that's one factor. Another factor is, a lot of people are worried, right? There are these mutants, there's these variants that are being uncovered. Now, there's that concern. We have this vaccination. Is this vaccination still going to be working?
There was also a South African variant, and as at the time of recording in late 2021, a new variant was discovered in Brazil. And so think it just goes back to our early discussion that as time has gone on, this ancestral virus has started to not only mutate, but also starting to different regional almost versions of it has started to pop up around the world. And I think that would lead well into our next discussion of what's the social implications of these mutations and these variants, right? And depending on where you live, what kinds of social or public health measures are in place, the effects felt by the populations there are different. What is the real or the potential impact that these variants might have on vaccine development or on the state of vaccinations or immunization programs that certain countries have already started?
That's a loaded question.
Unpack.
I mean, I think in general, with all these mutations, it comes down to a couple of things. And of course, different countries have different responses, different communities have different responses. And with that, they have different capacities as well. But according to the WHO, when we're considering these variants, from, I guess, the individual level almost, these mutations are happening, every day, all the time. So from our perspective as citizens of our respective countries, it's important to follow these public health protocols, right? And the WHO on their website also notes that the potential for virus mutation increases with the frequency of human and animal infections. So their solution is basically by reducing these overall transmission events, you're essentially reducing the overall potential of these viruses to mutate. And so with that, you have to consider the global strategy of being able to reduce and follow these public health protocols, whether it be through PPEs, personal protective equipments, frequent hand washing regimes, cough etiquette, wearing a mask when in crowds, and in Canada, in Ontario at least, preventing non-essential traveling. So there's different measures that are in place to prevent this kind of spreading of these variants.
Another point that I want to unpack here regarding the implications of these viral variants on the pandemic is whether these variants will further impact the already vulnerable populations who have experienced COVID-19. So as we see across the world, populations and subpopulations within countries are not affected the same by these variants. And I wonder if if these variants would have any additional impact on people's access to health services and things like that. Noting, of course, that the variant itself isn't going to make people, I would say, it's not going to make things worse, but I think just the fear or even the increased transmission might, if it affects a population who is already struggling to cope with the pandemic, and it gets hit with a variant that makes it more transmissible, I think that in itself has a lot of negative effects.
No, I think that's an important point to touch on, because while the severity of symptoms and maybe the mortality rate is staying the same, if the virus is able to infect 10 times the number of people, in theory that's 10 times the number of deaths or hospitalizations, for example. So I would say definitely there would be a disproportionate impact on certain communities and certain countries who are maybe on the resource low setting side. If the healthcare system is already overrun, to then put additional strain on it from these variants that are more transmissible would put more people in a position where they would get sick and need to be hospitalized and receive treatment in the hospital. And if our infrastructure is already being challenged because we can't keep up with variants that are less transmissible, that's not good news either. Mm-hmm. And at a certain point, that threshold is going to be far surpassed where hospitals are able to keep up, and then we might even see more disproportional death on top of that. So I think that's a very real concern. But I want to go back to the vaccine development part too. So in general, the transmissibility part, we mentioned that the strain that the variant that now predominates, the D614G, there was a mutation that occurred in the receptor binding site on basically the spike protein that latches onto your cell, and basically that's how it makes its way into your cell. That also exposes sites, as LaShawn mentioned, to be neutralized by antibodies. So in terms of vaccines, which are the ones that are generating an immune response to create those antibodies, in the long run, perhaps that's a good thing, in that the vaccines, we're not as concerned about the vaccines not being able to work. One, because those elements that it targets seem to favor transmission, which then favors how well the vaccines can work. And then two, the vaccines aren't only for a specific area of a viral particle. It generates an immune response in a broad sense as well that's able to recognize these viruses. So if we have one kind of mutation that we're concerned about, that doesn't completely negate how useful a vaccine can be.
Yeah, one of the things that I want to bring up on the topic of vaccinations is, when we're talking about marginalized populations and communities, we have to note that there was a recent report mid-January that indicated that, there was just 25 doses administered in low-income countries in Guinea, and that was just one country, whereas all the other wealthier countries, around 39 million doses were administered. So it's a striking difference between, the delivery and distribution of drugs between low income countries and higher income countries. So there has to be something there, or at the end of the day, these variants may be transmitted to these communities, and they won't have even the protection from vaccination to even combat it. So it's a very tough situation.
Yeah, and if you unpack that even more, LaShawn, we know in terms of the vaccine, COVID-19 vaccine or the SARS-CoV-2 vaccine, there are a couple vaccines that have been approved or moved through the pipeline. We know about the Pfizer, we know about Moderna, we know about the AstraZeneca Oxford. There are also a couple of different ones that have made its way that have been developed by other countries.
Yeah.
And the based on the results of those studies, we know that the efficacy is actually lower than some of those other vaccines like Pfizer that are being distributed in the higher income countries. So on top of the low income countries only getting, like you mentioned, LaShawn, 25 doses, what types of vaccines are they getting down there? Are they getting the lesser effective vaccines as well? Because that's doubly disturbing on top of them not getting that much at all.
Yeah.
And on top of that, what the populations think about these vaccines, which directly affects their participation in immunization programs, because directly depends on their trust for these vaccines.
Yeah, no, and it's just in response to that figure that LaShawn shared of 25 doses? Yeah, that's a real wake up call, but also an illustration of just the inequities, right, that exist in
Huge
health and global health. And I think just going back to one of the point that Sully and Vashan both raised, which was the social stress and fatigue associated with the pandemic. For me, it seems clear that as research is more research is uncovered regarding the transmission of these variants, it seems likely that additional travel restrictions or lockdowns or public health measures will be placed. And as Vashan said, one of the ways to almost combat these mutations is to stop it from spreading, right, and stop it from further developing. But I think it's what I really want to question is, after a year or even longer in some areas of being confined and controlled by these measures, it's really like what Sully said, how likely are the local populations and communities willing to endure it for much longer, right? And it's I feel like there's eventually going to be a tipping point, and hopefully there isn't, but the risk of a tipping point where people are just gonna say, screw it. And when that happens, the real effort to control this thing is gonna be jeopardized.
Yeah. Hopefully vaccines are the silver bullet.
Yeah. But you know what, too? It goes back to something we talked about in one of our earlier episodes, too. Like, for countries where the roads are good, maybe you're less likely to die in a road traffic collision. Maybe you're less likely to die from, other conditions because the healthcare is so good. People are out there worried about dying from hunger. So maybe you, me, and the four of us here aren't concerned about not eating tomorrow. There are people out there that would probably choose to put themselves at risk of COVID-19, whether it's in Canada or other low-income countries, in order to earn a living, because they believe they're more likely to die from just starvation than dying from COVID-19. So everyone's health priority is different too. And like you mentioned, people are like, these sweeping stay-at-home orders and stuff in different countries where that are more impoverished. It's not likely that it'll be last when people's well-being is, if you're living paycheck to paycheck and you need to go out there to work, maybe you're less likely to heed those measures. And can we blame them?
I think that's just a perfect illustration again of, in a global pandemic and an international public health emergency, it's far beyond simply looking at the health or the health, like your biological side of things, but more so than the social aspects, and just how this pandemic really displayed and showed us that similar emergencies will likely happen in the future, and it needs to be an all of society effort. I guess in the interest of time, just to wrap this up, fellas, one final implication that I found interesting, and I think is also very relevant, related to these new variants, is the issue of stigma, right? Given that there is no agreed upon nomenclature for these variants, as we've seen, you have your D614G, you have your VOC20. It's all kind of in shambles here as of now. People tend to refer to these variants by their place of origin, or where they were first
detected.
detected.
Variants.
Yeah, exactly. UK variant. You have your South African variant. You have the
former
Brazilian.
president of the United States was calling the initial virus as well.
Yeah, the Wuhan variant. So, and I think this is something that PAHO mentioned in one of their webinars and series, where they talked about that the global community, and especially the global scientific community, must come together, in a collaborative fashion to have an agreed upon nomenclature. One, just for the sake of organization, planning, and all that stuff, but also, to reduce the risk of stigma towards these countries and people who are from these countries. We saw this at the beginning of when the pandemic first started, with cases spreading out of Wuhan and the backlash faced by East Asian and people of Chinese descent. And as LaShawn mentioned, especially if you have a president of the country kind of feeding the flames, I think as more and more variants begin to emerge, hit our news headlines, and feel the effects of it, it's also important to note the stigma that might be associated with that.
Yeah, no, absolutely. And language is so important, and like you mentioned, can give rise to stigma and, have certain connotations behind the language that we use. In terms of, I guess, that global effort, that global concerted effort to, come up with more standardized nomenclature, I think that's going to be important. I do realize, and I did mention earlier, that there's a lot of gaps in information and information sharing within countries and across countries. So the WHO, in some of their reports, they always mention, you got to make some of this data widely accessible to the public and for the collaborators worldwide to be able to come up with these strategies that would enable them to come up with the standard nomenclature. Because if one individual in a certain area of the world, detects a virus, and maybe there's a similar variant somewhere else, how do you kind of connect those two together to say, okay, maybe they're slightly different, how much different, can we classify them as the same type of mutation? These are kind of ongoing dialogues that are happening globally right now, and I think it's essential. We have to. COVID-19 is already such a huge burden globally, and they're affecting communities disproportionately. So anything we can do at the leadership level, the scientific community level, I think is going to be important to help reduce that stigma.
In most instances, mutations in the viral genome do not increase their ability to spread and cause severe infection. However, recent examples of emergent variants of COVID-19 or the SARS-CoV-2 virus demonstrate that the threat of more transmissible viruses causing COVID-19 remains very real. One thing is clear though, public health preventative measures still remain our best defense against this virus, despite the recent developments with therapeutic interventions and vaccines. As we continue to focus our efforts on ending the pandemic, we must ensure that the unique needs of vulnerable communities and countries remain at the forefront, and for us as a global community to come together to tackle this issue. My name is Will, your host for this episode. Signing out.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.